We got a couple of IV bags run when we travel because it helps with jet lag hugely. Do you want to quickly explain what IV bags are and when they would be of use?
Okay, so basically when you're doing IV therapy, you're getting an influx of nutrients that you wouldn't normally be able to do in that amount. In some cases like glutathione, getting glutathione into the body through a different mechanism than normal, because normally oral glutathione is not very well absorbed.
Okay.
So you would use, typically, like if I was wanted to get someone's glutathione stores up and they weren't doing IV bags, I would give them N-acetylcysteine, which is a precursor, and then I would give them alpha-lipoic acid, which stimulates NRF2, which is your master pathway for making glutathione. Most people don't know what I'm even talking about. So your normal,
well, now you're learning.
your trainer wouldn't probably not know what I'm talking about unless your trainer is a doctor, or a biochemist. So
running an IV bag therefore just puts it straight into your bloodstream.
Straight into your bloodstream, and it's a really good, especially what we'll typically get is a Myers cocktail. So you're getting a little bit of vitamin C, you're getting some glutathione. We'll get an extra B12 shot. Really helps out
Magnesium's in there too,
magnesium,
right?
little magnesium, a little bit of a lot of stuff, and then you can get carnitine, you can get vitamin C as long as you get a blood test to see if you've got that genetic issue that we talked about before. About too much vitamin C can cause some really bad havoc. It can actually kill you. You 10 or 12 gram vitamin C push is probably not a big idea, but when people do these massive 30, 40, 50, 60 gram pushes, it can mess people up. But so fatigue, high oxidative stress, somebody on if you're really on a big time fat loss diet, you store toxins in your fat, you're gonna have to neutralize those.
That's a really good point. So a lot of toxins are stored in fat. So when people lose fat rapidly, they're releasing a lot of toxins into their system. So you want to support being able to get rid of those. Right,
and also you talk about energy production. If you're burning off fat, you're regulating energy production. One of the main sites of free radical production is in your mitochondria. So you want to make sure that you're going to be able to neutralize that. So the faster you lose fat and the faster you're making energy, the more antioxidants you're going to get. So it's good. So what we typically recommend people, twice a week for about 4 weeks, and then you can usually go once every week or two. If you can afford it. It can be pretty pricey.
Depending where you are.